In this video, we'll explore the connection between mental and physical health and provide a few tips for your overall well-being. You notice when the check engine light comes on and schedule a car inspection. You notice you're having flu-like symptoms and visit the doctor. But what do you do when you feel overwhelmed? When you experience signs of mental distress, please do something about it. Mental health problems can cause chronic headaches, shoulder pain, nausea, difficulty breathing, extreme fatigue. You might not feel like yourself and lose interest in things that you used to find important. You might eat or sleep too much or too little. Ignoring these signs can put our health at risk and impact day-to-day living. Ongoing or severe stress may increase the risk of depression or of developing an anxiety or sleep disorder. It may also lead to high blood pressure, obesity, and diabetes, to name a few, or complicate the management of these and other chronic health conditions. The good news, there are a number of behavioral health strategies that can be helpful for whole person wellness. An excellent habit is to set aside 5 to 10 minutes each day for a self-check-in. Simply start with a head-to-toe body scan and identify how your body feels. Is it tense? Is it relaxed? Also check in on your thoughts. Are they racing, focused so much on the past, or stuck thinking about the future and what-ifs? Or is your mind clear and focused in the moment? Take note of any physical, emotional, or behavioral changes. Physical and behavioral changes can include difficulty sleeping, changes in eating habits, nightmares, increased drinking and smoking, social withdrawal, feelings of sadness or hopelessness, feeling worried and unable to relax, increased irritability or anger, and increased sensitivity. Stress is a normal part of life, but we must recognize when stress starts to cross over from the healthy kind to more unhealthy or maladaptive stress. Generally, that happens when high levels of stress intensify, continue for long periods of time, or exceed our ability to effectively cope and function. During self-reflection, simply consider how the day went. You may learn that your fast heart rate comes about when you're thinking about a conflict at work or when you're worrying about a loved one. Simply take notice. You may want to set a healthy mindset or set an intention for how you'd like to respond or lead tomorrow. Don't forget to create space for moments of gratitude, things that went well, sparked joy, or give life meaning. They may not erase some of the difficulties of life, but they can sure balance it out. Quality sleep, exercise, healthy eating and hydrating with water, as well as self-care efforts such as deep breathing, meditation, listening to music, writing in a journal, and spending meaningful time with loved ones are important to overall physical and mental well-being. Speak openly with your healthcare provider. They can help you determine the best next steps and provide an introduction, referral, or other starting point. Sometimes just a few visits with a behavioral health provider could be all you need. At Healthcare Network, we are committed to treating the whole person in both body and mind. Our primary medical and behavioral health providers work together, hand in hand, in a team-based integrated model of care, providing services in the same place and often at the same time. We could all use a mental health checkup. Make an appointment with a Healthcare Network provider today to learn how we can support your healthcare journey.